All right, welcome everybody to Webinar Wednesday. My name is Jana Petchuk. I am with the American Heart Association and very pleased to be able to partner with the North Dakota Brain Injury Network on these webinar events that we are having 2 Wednesdays out of the month. In 2019, this year, there was legislation passed which allowed for a change in the definition of brain injury here in North Dakota to include all types of brain injury. And that is how we as the Heart Association / American Stroke Association are now partnering with the North Dakota Brain Injury Network on these Webinar Wednesdays. The goal, of course, is to bring resources to individuals who have experienced brain injury here in North Dakota to help them be more aware of what all exists in our state to help them in their recovery process. And here you see contact information for Carly from the North Dakota Brain Injury Network. If by any chance you have suggestions for a topic for a future Webinar Wednesday, we would love to hear about those. And today we are excited to announce that we have Emily Wangen she's a musical therapist and owner of Musical Therapy in Motion, located in Fargo and Grand Forks. And with her, she also has Anna Mitchell. They'll be telling you or teaching, or they'll be making you aware of what music therapy is and how it can assist individuals in their recovery from brain injury. So with that, I'm going to turn things over to Emily and Anna. One moment here.
All right. Hello. Let's see. Okay, so I'm just trying to make sure that I understand what I'm doing here. I want to share. Can you hear me?
I can hear you. Yep.
Okay, so I want to share. Okay. Here we go. Can you see that?
Yep, perfect.
Perfect. Great. Well, my name is Emily Wangen, and I am a music therapist and the owner of Music Therapy in Motion. I am also joined here with Anna Mitchell, and she is she's a board certified and licensed music therapist as well. We are actually coming to you from Fargo today, and we have locations in Grand Forks as well as in Fargo. So with that, we are going to be presenting on neurologic music therapy, brain injury, and stroke. So thank you so much for having us today. Okay, so what you'll hopefully learn from this webinar is an overview is that you comprehend and take away a basic definition of music therapy in rehabilitative care, including brain injury and stroke. Also, we hope that you acquire information regarding research-based therapy practices in music therapy, as well as neural rehab settings. We're going to discuss a little bit about our different instances and experiences that Anna and I have both had, as well as our other colleagues have had in music therapy, and which you might not be aware of, and talk about different experiences that might be useful. And certainly if you guys have any questions or would like to just chime in, please, we would invite you to interrupt us at any time, and we welcome that as an option. And then also we hope that we are clear on how music therapy in motion can benefit individuals who have had a brain injury or stroke. So this is who we are. Actually, I was gonna go back here. I was gonna try to see if I could, can you still see me?
I can't see your slides anymore.
Oh,
Let's just stop sharing again
okay.
if you.
Sorry.
No, there we go.
Oh, can you see me now?
I can see your face now. Yes.
Okay, great. Yeah, I just wanted to make a little introduction. Like I'm Emily. Hello, and Anna, are you able to?
Yep. I will start my video here. Hello.
Hello.
I'm Anna.
Great.
Great
So
to see your
just
faces.
Yeah, just so that you guys can see our faces at least to know who we are and what we do. Anyway, this is our logo, Music Therapy in Motion. And we are, like I said, we are in Fargo, Anna and I. And just to give you a little bit of background on who we are and what we do, I thought that it would be nice to kind of give you a little view of our lovely selves. So I'm going to go back to, here we are. Uh-oh, did I make a mess?
That
now?
same button on that bottom right will take you back to your presentation.
Right. Oh, okay, here we go. Oh, can you guys see? Oh, here we go. There we are.
There you go.
Okay, perfect. All right, so Music Therapy in Motion provides music therapy services across 15 counties in North Dakota and Minnesota, including the Red River Valley, and actually now we're into the James River Valley as well. And, oops, uh-oh, sorry. We were established in 2006. I actually started Music Therapy in Motion in Grand Forks. I was working as a paraprofessional before becoming licensed as a music therapist, and with that started creating contracts in schools, in private practice in individuals' homes, and pretty much started to knock on more doors that we were kind of tapping into the music therapy world. UND had created their music therapy program in 2001 and 2000, and I came in 2001. And so basically we saw music therapy as a necessity in North Dakota. And at the time it was really seen as like a new concept. And so there was a lot of groundbreaking and knocking on the doors, like I said. So right now, we've come a long way. Anna actually just celebrated her 10th year with Music Therapy in Motion, as well as a professional. So we're grateful to have her. And congratulations on making your 10 year. Also, we have 2 clinic locations, which have been exciting to open and to watch us grow in that regard as well. So, I'm sorry, I just want to make sure, can I turn, are you guys still seeing my face?
We see your face and the screen, which is just great. Yeah.
Okay, so is that okay? Is that?
Certainly. Yeah.
Okay, perfect. And so I just wanted to make sure that you guys were able to see me okay. So we have a team of 6 board certified and licensed music therapists. We bring over actually about 45 years of experience to our communities, partnerships, and clients across North Dakota and Minnesota. Our team has specialized training in neurologic music therapy, including Anna and I have both went through the intensive neurologic music therapy training at the American Music Therapy Association conferences. With some of our colleagues that have been basically kind of the creators of neurologic music therapy and the acronyms that are being used in upcoming research. And so it's really great to be able to be educated at a national level in that regard. With specialized training in behavioral health, trauma-informed care, addiction, neonatal music therapy, and various other opportunities as well. So, Anna, do you have anything to add to that? Did I miss anything?
I don't think you missed anything. That kind of covers a lot of who we are and what we do.
Okay. Yeah, so what is music therapy? So just to give you a little bit of an example and the definition, is music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. And that is the definition given by the American Music Therapy Association, which you can find more information about music therapy in general, as well as specific populations, or to find a music therapist in your area, you can certainly find that at www.musictherapy.org. Qualifications to be a board certified and licensed music therapist. I'm going to let Anna kind of take this section.
Sure. So to be a board certified and licensed music therapist, you have to complete your 4-year accredited music therapy program. I personally completed mine at the University of North Dakota. I know Emily has mentioned that program earlier. And then after you finished your degree program, you complete a 1,020-hour national roster internship. There are interns internship placements all over the country. And so there's a wide variety of different styles and populations and areas that you can choose to do your internship for. And then after that, you sit for your national exam for music therapy. And provided you pass, then you're able to practice music therapy. And now in the state of North Dakota, we have passed our state licensure. It was passed in 2012. And I know we're always really excited to share that North Dakota was the first state in the nation to require state licensure for music therapy. So that was a really exciting thing for North Dakota and a huge accomplishment. Yeah, for the music therapists that were a part of that. So we are now required to be licensed with the North Dakota Board of Integrative Health to practice in the state of North Dakota. There are several other states that do require licensure, though not all in the country currently require that, but it's kind of a work in progress on all those.
Great. So yeah. So where is music therapy being used? These are just a couple of different areas, I guess, that we use music therapy in our area is rehabilitation facilities, psychiatry, outpatient therapy, hospitals, inpatient and outpatient and partial hospitalization programs, private practice, including clinic and home visits, schools, day habilitation programs, residential placements, skilled nursing facilities, excuse me, memory care, hospice, and wellness centers. So there are a variety of other locations too that we certainly provide in as well. So like your daycares, we've also provided in settings maybe for wellness programs for organizations that deal with trauma or community liaisons. So the options are really truly endless. So what does a music therapist do? Well, we try to access emotional well-being, physical health, social functioning, communication abilities, and cognitive skills through musical experiences. We design music sessions or interventions for individuals and groups based on client needs and preferences. And we also participate in interdisciplinary and treatment planning, ongoing evaluation, and follow-up. Is there anything else you'd like to add in here, Anna?
Nothing off the top of my head other than, I mean, in addition to this list, granted it's not a comprehensive list or end all be all of everything that we are able to do. I know we're going to talk later a little bit more about specific interventions and exercises that we do in music therapy, but I often do say too that what a music therapist is able to do is often really only limited by what our client or our patient or our facility is interested in, or maybe what their goals are, and then the creativity and kind of the thought process of where the music therapist can take the music and use it to accomplish that goal. So, this is obviously a great list, but there's also so many other things that music therapy can accomplish depending upon what a goal or an objective might be for that facility or client.
Right. Yeah. So what does a music therapist do? We do a lot of things. We certainly provide an assessment. We're involved on the treatment planning for individuals. We provide one-on-one sessions in addition to group sessions. Oftentimes we're creating adaptive lessons, meaning lessons that might not look, I don't know, like your your normal piano lesson. Maybe we're utilizing color coding, or perhaps we're adapting it in a way that maybe the guitar, maybe we're using an adaptive device on the guitar so that it makes it easier for an individual who has endured a stroke, being able to press only 4 keys versus, a complex stringed, I guess, diverse opportunity of chording a guitar. So with an adaptive device, there are lots of opportunities to engage in music lessons, and truly the sky is the limit. A music therapist is generally creative in their nature as well as flexible in settings. And so we can provide adaptive lessons, recreational community drumming groups, provide services not only to patients, but also families and caregivers, interdisciplinary collaboration. Today, actually, this morning, we were just talking with a large corporation in town about how music therapy and science and biotechnological research can go together, and what we can do as music therapists to provide wellness and stress relief, and maybe even education into a scientific relationship. So I think it's interesting how music is moldable and very flexible. Ongoing treatment planning, and also advocacy. Music therapists are really passionate about what we do and the individuals that we work with. So we're always trying to advocate for the opportunity to see the best in our clients in addition to our profession. Yeah, anything here that we would like to add? Okay, so what to expect from a music therapist? Well, you certainly can expect compliance with the expectations and requirements inherent in the medical model of treatment, as well as professionally trained music therapists to design and utilize individualized music experiences to assess, treat, and evaluate patients. Now, you might be wondering, what do you mean by that? So a professionally trained music therapist is obviously a music therapist who has gone through the schooling, has sat for their board certification like Anna discussed, as well as is licensed. You must be licensed in the state of North Dakota in order to say that you are providing music therapy or to provide services. It is illegal to provide music therapy services in the state of North Dakota without a license. And we are actually very proactive on educating music therapists in our region on the licensures as well, because actually I was part of that task force and am currently the chair of the North Dakota Board of Integrated Healthcare, which oversees the music therapy licenses. So we're very interested and want to make sure that our the constituents of North Dakota and the people that we are providing services to have access to professional as well as educated and continuing education so that people have the best care possible. We also want to make sure that we're evaluating patients, assessing and treating them with dignity, of course. And then music therapists certainly describe our work, like when we're documenting, we're describing what we do in medical terms. So oftentimes people will ask us, well, do I have to be musical to understand music therapy or to take part in music therapy? Absolutely not. That's not the case at all. You don't have to have a musical bone in your body. However, we know and research indicates that we recognize music in utero, so before you're even born, and music is innately within us, rhythmically as well as physiologically, our heartbeat. So we know that even to the very end of life, one of the last things that we hear or recognize can be music. So you do not have to necessarily play an instrument or come from a musical background in order to engage in music therapy services. So, Anna, do you have anything to add to that?
No, I was going to add like what you had said about how we're just innately musical, that music
Okay.
cues into so many aspects of what we are and what we do. And I know we're going to touch on that a little bit more about how we can harbor that musicality that we have within us and use it to achieve those goals that are non-musical in nature.
Mm-hmm. Yeah. Are you guys still able to see us?
I think we can see
you, Emily, but not Anna. She must have hers turned off.
Okay. I wasn't sure. I mean, it makes no difference to me. I just wanted to make sure I wasn't turning
Pushing too many buttons and then.
Right, exactly. Yeah. I was like, oh goodness, how many buttons have I pushed now? Okay. So let's see, what is music therapy? Why is music therapy? So music has a profound impact on the brain, and it can stimulate all areas of the brain. That's the beautiful thing about music, truly, is that it can encompass so many parts and build neuroplasticity in ways that other stimuli are not able to. So music is a multi-sensory experience in that music directly affects our physical, emotional, and tactile responses, as well as it increases our brain neuroplasticity. And in fact, actually, before we were putting together this presentation and also for the Mind Matters conference, I was looking at some different research on neuroplasticity. And there's some current research out that has really indicated some nice findings. I was just pulling one that is out of, I believe, Norway by Dykestein, if I got the last name right. I'm not sure that the pronunciation is correct, but this one was looking at the effects of music production and cortical plasticity within cognitive rehabilitation of patients with mild traumatic brain injury. So what we're just really looking at is how we address and stimulate neural networks in rerouting neural connections in link up of the cortical circuits that have been functionally inhibited due to a disruption of brain tissue. And so it looks at what it really found, I guess, in conclusion, is for the first time that ever, really, they've demonstrated behavioral improvements and functional brain changes after 8 weeks of playing piano on patients with mild TBI, having attention, memory, and social interaction problems. They present evidence for causal relationships between musical training and reorganization of neural networks, promoting enhanced cognitive performance. So these results add a novel music-supported intervention within rehabilitation of patients with cognitive deficits following mild traumatic brain injury. So really, in conclusion, is that, looking at the ability for someone to have attention, memory, and social interaction problems, this is really great findings that they're able to access that. And so we're forever grateful that our research is coming along, and certainly we know that other countries are working hard, and the US is doing as well. They're trying hard to. So with that, multisensory experience, which I was talking about. So music therapy is also a great addition to a multidisciplinary team, in which I think we'll talk a little bit more in it forward, but how therapy can be used as a co-treatment for an individual as well as therapy staff. So how is it beneficial for a music therapist to assist an occupational therapist or a physical therapist in the treatment of someone who has had a BI or a stroke? Also, it can help aid patients and staff within the treatment plan of therapy. Okay, so Anna, do you want to take over here?
Sure. So continuing on that, why music therapy? Neurologic music therapy techniques can utilize music with gait training and can help with co-treatment or in one-on-one settings. Again, talking about us being innately musical and having rhythmic just to be part of who we are as humans, that music can go in and tap into that and help someone that has been affected, that has their gait has been effective. And that there's a beginning to music, there's an end to music, and there's a tempo that continues throughout, right? And that music helps us to anticipate our next move, whether it's a beat, if it's a certain song we're familiar with, the lyrics we're familiar with. Music has such a structure that it can set up both our movement and also different levels of our cognition. So music with that also has the unique ability to connect patients, family, staff, and really the entire treatment team. We have found that just in our own practice, that there's very few people that don't connect with music on some level. And I know Emily and I spoke earlier this morning with another organization talking about how even for those that maybe don't speak the same language, that music can be that universal connection, whether it's something with lyrics or maybe it's just music that has a melody or rhythm, that again, being innately rhythmic or innately musical, it's that universal connector for us. So it helps us to get motivated with the use of music to engage patients physically, socially, and emotionally.
Yeah. So when we're talking about how do we, really start to work with our community, community partnerships. So in addition to working within our clinics in Grand Forks and Fargo, we have over 40 community partnerships in Fargo, Moorhead, and Grand Forks. So we partner with recovery centers, mental health facilities, schools, hospitals, rehab centers, hospices, senior living communities, memory care settings, juvenile centers, day habilitation placements, child care centers, group homes, and adult programs. So really, we are just partnering wherever possible. Music has a place for literally everyone. In music therapy, like I said, the sky is the limit. As long as you have a creative person or, brains thinking alike, trying to find ways in order to increase access to services or increase ability to function. Really, music can help all of that. So our research, as I was just kind of pointing at or getting ahead of myself a little bit, it looks like, research results and clinical experiences attest to the viability of music therapy, even in those patients resistant to other treatment approaches. I know in some of my work I've seen, after a brain injury, there can be behaviors or there can be inattentiveness. There can be executive functioning issues. So when difficult situations like that occur, oftentimes that's a perfect example of when a music therapist might be called in on a team approach, or when a family or a doctor or a therapist makes a referral to a music therapist asking, is music appropriate to help this particular patient increase or decrease their behavior? Would it help them increase their gait ability? Or maybe music acts as the distraction. So while they're singing and while you're playing your guitar, they're more willing to allow us to walk them down the hallway, or playing a drum, a steady beat in training the rhythmic auditory stimulation, like giving them that external pulse outside of themselves helps them concentrate on that thing versus what's happening physically. So that leads right into music as a form of sensory stimulation, which provokes responses due to the familiarity, predictability and feelings of security associated within it. So like Anna was just talking about, music has a beginning and has an end. There's always this predictability. There's usually some sort of security associated with it. There's extensive research demonstrating effectiveness of music therapy within TBI, concussion disorders of consciousness, stroke, Parkinson's disease, spinal cord injuries, pain management, gait, balance, and overall patient well-being. So I guess, Anna, do you have anything to add in that regard before?
Nope, I think you're clear to go ahead.
Okay. All right. As we're talking just a little bit more about the research, I did want to cite a couple other articles. And first of all, if any of you here listening or watching has questions about a specific modality in which we describe later, or if we have talked about it, if you're wondering, okay, is there any research on music therapy and prefrontal structural neuroplasticity, or is there anything on executive functioning, or perhaps maybe it's about behaviors? We certainly can help you look up some of that information, because I think that there's always new research coming out, and we certainly are trying to keep on top of that. But even like with stroke and aphasia, so how does music therapy show significant improvement in spontaneous speech? And there are some really great articles back in 2015 that cite some of that information. So I won't be too wordy on the research aspect of that, but you can certainly, if you are listening and if you come to the Mind Matters conference, we can certainly give you some of that information and bibliographies during that time as well. So, music therapy goals for brain injury and stroke. One of the first things that oftentimes we're working on with brain injury and stroke is movement. So why does music engage, or why would we use music in order to facilitate movement? First of all, because it can increase or enhance strength and endurance. It can take away that work effect, or think about like when you're on the treadmill and you're walking along. If you had no music, or if you had nothing to watch in front of you, you might tucker out a lot easier versus if your brain is engaged or physiologically entrained into something outside of your physiological experiences. So also music therapy goals might be coordination. So how do you hang on to a mallet, drumstick, and hit the drum? That action of moving the wrist, supination and pronation, or extension and inflection back and forth. Range of motion, how music therapists oftentimes are using scarves, or maybe it's like these paddle drums, or perhaps it's a kabasa where you have to move your wrist back and forth. We're trying to help increase, improve, enhance those opportunities, and it's all done through music. So it's fascinating because music is the prime stimulation, but we're not working necessarily on like music performance. It doesn't matter if you're not musical. We also often are working on balance and posture. So, after having a stroke, are you able to stand on 2 feet with, can you balance more readily when there's a music stimuli in front of you? Are you able to walk at a steady pace? Is your posture more erect, or are you more susceptible to slouch when you're sitting down? Also, dexterity is something that I think music therapists, write goals for. Moving on to speech and language, dysarthria and dysphonia, utilizing music in a variety of ways because of singing, and the way that music attaches in the speech center, I think, is really important. We'll kind of go through a few more of these slides in depth as we go forward, but fluency and articulation, intelligibility, as well as respiratory strength. Playing kazoos is one thing that I think a lot of, actually yesterday was National Kazoo Day, if you didn't know. I did not have my kazoos out, but I saw that other music therapists were making fun videos of using kazoos. And I think that there are these tools that oftentimes we might relate to childhood or might relate to our past and dismiss. However, when we're thinking about rehabilitation and after having a stroke or being in, maybe in a coma or having a medical event where you've been laid up for quite some time, respiratory strength is something that really needs to improve and increase. And so playing a melodica or playing a kazoo is something that can be fun, yet kind of childish, but yet give you an alternative way to exercise without having to feel like you're blowing in the the respiration measurer. I'm not sure exactly what that's called at the moment. The word is lacking. But anyway, so going forward there, in cognition, we work on memory and attention, as well as auditory perception. All right. Okay. Anna, do you have anything else to add?
I think in the upcoming slides here, we're going to describe a little bit more about what that might look like specifically in music and neurologic music therapy for someone. So I can add some of those when we get there.
Okay, yeah, just interject as you want. Neurologic music therapy. So what is neurologic music therapy? It's the therapeutic use of music applied to sensory, speech, and language, as well as cognitive and motor dysfunction after a neurologic event or diagnosis. So it could be an acquired brain injury. It could be a traumatic brain injury. It might even be stroke or a neurologic condition, or perhaps even, with the heart association, perhaps you have a heart attack or without oxygen for a period of time. Neurologic music therapy is based on the neuroscience and research of how music is processed and perceived in the brain. Neurologic music therapy is using music as a tool in neural rehabilitation to improve non-musical goals, which I think we've talked about here. So communication, motor, and social skills are oftentimes goals that we're looking at. Interventions are often based on scientific knowledge of music perception and production and the effects of this treatment on non-musical brain and behavior functions. So we're not looking at like, oh, how many chords or how many stanzas can you play? We're looking at, can we increase your gait, your velocity or stride length by 10 beats per minute in this exercise, or are we able to help you increase your oral motor respiration rate by playing the kazoo for 30 more seconds than you were able to last week? So looking at the non-musical aspect, the medical aspect, or the scientific aspect, I guess. So neurologic music therapy techniques, what are they? First of all, sensory motor, movement, rhythmic auditory stimulation, which I've discussed just briefly here in the past, is really talking about like gait training. So using music and rhythm to assess and eventually help manipulate and train irregular gait patterns and cadences. So a perfect example is you have who has had a injury, perhaps they have been in a car accident or hit by a train of something of that nature. They've rehabilitated for quite some time. They've been going through physical therapy, occupational therapy, speech therapy, and perhaps they're graduating from all of those programs. Yet they come home and there's still room for improvement. They're still using a walker. They're still their speech is still really unclear. How can music therapy affect? Well, we're going to use a specific beat to a metronome, walking using a regular auditory stimulation in order to entrain that irregular pattern. So an example of this would be is if any of you have watched my TEDx presentation with an individual who I worked with a few years ago. We talk a lot about how that cadence increased and how the ability to pick up speed as well as take more steps in a duration of time really can happen through music. Also, pattern sensory enhancement. So using musical elements to provide spatial and temporal cues to movements that are not intrinsically rhythmic. Accompanying physical therapy exercises. So like trying to increase endurance, decrease fatigue levels, like I was talking about before. One example of this might be, I can just think of working with some particular individuals at a fitness center, and we had them actually laying on yoga mats, and we were working on extension and inflection of the hip. And so a music therapist might be holding out a tambourine, and that's the point of where we want you to move your knee or your hip to, is to tap that tambourine and then move it back 90 degrees or whatever the radius is, but move it back and forth. And so there's actually like a starting parameter and then there's an ending parameter. And so using a pattern in order to intrinsically accompany the physical exercise. Also therapeutic instrument playing, using
me, Emily.
Oh yeah.
Sorry, I have another example about that pattern sensory enhancement. It doesn't always necessarily include the instrument like for a target. I'm a great example that I know I've utilized several times for doing that example or that exercise. I had a group of gentlemen I worked with that had Parkinson's disease. And we would do some movement examples or music or movement exercises. But the big one that we would talk about, especially this time of year, that they were very concerned about was falling on the ice and on uneven ground for them, and as well as getting in and out of their cars because they often put their feet down onto ice. So we were practicing moving our feet and our legs, but more importantly, doing transfer of our body weight. And so a really great way for us to practice transferring our body weight rather than just standing and moving side to side was for us to waltz. And so I played a really easy waltz for them, and we would take turns holding on to chairs on either side. So it was stable. We had no risk of falling, but that we would move side to side with the beat and practice our weight bearing and moving our weight so that when we came time to practice getting in and out of cars, or that weight bearing and moving when we were on ice was a natural movement for them. And we used the music to really support that movement, but also to help them so that when they're on that uneven ground or slippery areas that they knew that they could use that technique. And it was something really effective for them. It was really helpful because they felt supported and ultimately safer when moving their bodies around in a very difficult time of year, especially in this area.
Yeah, for sure. Okay, sorry. I just accidentally. Okay. Good. Yeah. So therapeutic instrument playing. This is using musical elements to provide spatial temporal cues to movements that are not intrinsically rhythmic. So accompanying PT exercises increased endurance and decreased fatigue levels. So this is also like looking at, sorry, it looks like I might have inadequately. I might have messed something up there on the slides. I apologize. So therapeutic instrument playing. So utilizing, one of the examples that comes to mind is having a paddle drum, and maybe I'm holding it up here and I want the individual to tap, "I've been working on the railroad," and you're moving that drum from left to right. And so you're using the instrument in order to provide the spatial and temporal cue. Do you have other examples for that, Anna?
Nope, I think that was a great example.
Okay. So neurologic music therapy techniques regarding speech. One intervention that I think many of us have probably heard of, or if not, it's one of the more notable ones, is melodic intonation therapy. This uses patients' unimpaired ability to sing to facilitate speech production. So singing spoken phrases and phasing out melody. So like, "You are my," and naturally you'd sing "sunshine, my only sunshine. You make me happy." So leaving out ends of the phrases. So Gabriella Giffords, her mode of neurologic music therapy, to regulate her speech. So she utilized music therapy and speech language therapy in order to help her regain. I know that we use this a lot in our work, not only with brain injury and stroke and medical diagnoses, but with children, with adults. Like last night, I'm working with, 10 individuals who have multiple impairments. Some are physically disabled, but have moderate cognitive ability, and they're able to sing all the words, where you might have someone who has a little bit lower functioning, but yet they're able to interject and sing, sunshine, or they're able to sing happy. And that's progress. Like, that's beautiful, giving them the opportunity to still engage in a musical moment, and being able to provide that is astonishing, I think. Musical speech stimulation. So how music therapy initiates or stimulates speech and vocal sounds, as well as leaving out words or phrases. So fill in the blank. Vocal intonation therapy. Training aspects of voice control, including inflection and pitch, as well as breath control and timbre. I'm just trying to think of some examples. Oral motor response or respiration, so OMREX, increasing articulatory control and respiration strength and function, as well as so like using vocal warm-ups like E-I-O, or something of that nature. Therapeutic singing, so utilizing a variety of exercises and techniques to bring it all together. And I think that therapeutic singing kind of encompasses really all of what we're talking about here. Okay. All right, so now moving on to cognition and cognitive techniques. Musical attention control training, so practicing focused and sustained, as well as selective and divided, alternating attention functions. So really using the ability to direct one's mind to a particular thing, meaning music. There are so many examples I think we could talk about in this regard. Anna, do any strike out to you?
I think just the practical implications of this one, the importance of it is for us to be able to hear something, whether it's a song or something musical, but still be able to focus on something else, which we tend to do every day, whether it's the radio is on or there's music on in the grocery store and we're still focusing on my to-do list or my grocery list, and not being so focused on one thing that we can't also do something else, which again, we tend to do naturally every day, but that music can help really isolate that specific skill of maybe attending to a certain task while also playing a song or a rhythm or an instrument, and again, really isolating that task so that when we have conflicting things in our attention outside of our music therapy settings, we've practiced that skill and we're able to generalize that skill into our everyday life.
Mm-hmm. Yeah. Musical mnemonics training, so exercising various memory, encoding and decoding, recalling information. So helping like large amounts of information becoming more manageable. So like helping verbs. So thinking of like the ABCs. Yeah, or were you going to say something?
I would say that in middle school, I had a grammar teacher, an English teacher, taught us the helping verbs song, and she'd like put it to a song that was already familiar, and we were able to sing it as a class. And I still now, years later, could sing you every helping verb in the English language because of that song.
Mm-hmm. Yeah. In fact, I know there's a song that I learned Spanish colors with that I oftentimes will use in my sessions too. So just thinking about how we're able to recall information oftentimes more readily when it's put to a melody. So music, psychosocial training and counseling. So in group settings, using interpretive value of music, so utilizing music from low energy to high energy, anger to peace, processing the functional expression of moods and feelings through music. Oftentimes, I think that we're utilizing this maybe within mental health settings or even adolescent or adult treatment centers, perhaps even forensics or addictions. Okay, so are there any questions or is there anything else that you want to add to the specific techniques that we've talked about today? Okay, if you think of something, email us or let us know. Also, we will provide you with our contact information. You can certainly reach out to us later. One question I think that many of us music therapists get a lot is music therapy reimbursable? That's a trick question. Yes and no. It depends on where you are. Just to talk a little bit about private insurance, music therapy is always considered out of network, and that's the way CMS has us listed. And music therapy uses codes that are often used by OT, PT, and SLPs. And activities. Sorry, I'm trying to move. Sorry, there we go. I couldn't see part of my slide because I had different things popping up here. So music therapy uses codes that are often used by OTs, PTs, SLPs, and activities as codes that are not profession specific. So the codes that we generally would use or could use are oftentimes used by other disciplines. Music therapists are careful not to use these in areas that have limited amounts. And we certainly try to clearly communicate with others on the treatment team to provide what's best for the patient. So meaning here is if you were to call us and say, hey, Emily, I would like to get music therapy set up for my son tomorrow. Is there a way that we could process through insurance? I wish I could tell you, yes, it was that easy. However, it really depends on your insurance plan. And we certainly are going to do the best we can to provide that information for you. Unfortunately, Blue Cross Blue Shield of North Dakota has music therapy under exclusions, and they wrote us under exclusions in 2012. We would love to be able to change that, and certainly that's going to take some state and national task force work, and we have been working on some of that. But other insurances will pay for music therapy. It's not, an end-all be-all. However, for us, oftentimes we advise families that it's cheaper for a patient to pay out of pocket than to use their insurance because say they had a stroke or you had an injury, you're probably receiving some other kinds of services like occupational therapy, physical therapy, speech therapy, activities therapy in some regard. So if you're receiving those services elsewhere, or in addition to wanting to add music therapy or co-treat with music therapy, we want to make sure that your funds are being used to the best of your ability, and that you get the most bang for your buck. And so if you only have 40 visits for OT, PT, or speech, we want to make sure that those can be used for that discipline, and that we're not necessarily taking away from those services. So usually we'll be really upfront. I mean, obviously we're always upfront with our patients and tell people that, it's cheaper to pay out of pocket than to use insurance if it is. Otherwise, if there's a possibility that we can run through private insurance, we will certainly do that. Okay, so Medicaid. If you are on Medicaid, does music therapy, is it covered? Well, generally speaking, music therapy is not covered by Medicaid in any shape or form unless you're on like a waiver system. In Minnesota, if you have the brain injury waiver, music therapy is covered. If that's the case, you would want to, or if you know people, or if if you have some of the relationships like we do, we live really close to the North Dakota and Minnesota line. So we kind of share that relationship. I would say that if you're in Minnesota, or if you receive services from Minnesota and you're on the waiver, ask your case manager, is this something that can be added to your plan? We certainly have seen many individuals and have become a Medicaid approved provider for brain injury because of this. This is one of your access to services. I think that oftentimes people don't know about. Music therapy can be group or individual, and it can really occur as often as the assessment or the team determines. So meaning oftentimes we'll come in and we'll do an assessment. During that assessment, we're going to sing, we're going to play, we're going to use instruments, we'll talk about the past, we'll see what kind of music is engaging for the particular individual or individuals, and then we'll look to see what kind of responses we get with music versus without, and different stimuli. And then make recommendations for how long, like a duration of a session, the frequency, whether it be like 1, 2, or we've even seen people 3 times a week, up to an hour 3 times a week. And then also if it's best to see an individual in their home, perhaps traveling is not conducive for a family or for the individual, or perhaps it's best for us to come to you 1 time a week and you come to us 1 time a week. So we really try to look at those options as well. And then after that, once we provide the assessment and gather information and collect our research, if you will, the agency contacts the music therapist to see if we're an approved provider, which, like I said, Music Therapy in Motion is. And then there's a service agreement that's issued. Music Therapy in Motion is then notified, and then we begin services and we bill Medicaid directly on a monthly basis. So that's how it works in Minnesota. Now, North Dakota has different waivers and different access to services. I would say that we as a whole and we as a state need to do some advocacy work on how to get music therapy as one of these approved providers. And I think that we're certainly coming up on some of that work. However, we're not quite there right now. So certainly advocacy is needed in this area. There are a few states that allow payment for music therapy services through Medicaid home and community-based services. Minnesota is one of those, and that's oftentimes how we see individuals or children under the age of 18. Also, music therapy might not be specifically listed within like regulatory language within your state, but it might be included in community support or rehabilitation or habilitation services. So if there are other questions about reimbursement, oftentimes people will say, well, how do we pay for music therapy then if it's not covered by insurance, or if it's not covered by Medicaid? I don't have the funds to pay for it. Well, you know what? Oftentimes we will do our best to make it as affordable as possible. So it's not much more than, going out to eat once a week, or being really creative with our resources. If we can pair you up with someone else that might have some of the same implications that you might need help with, or perhaps we partner and build community relationships with facilities that work with brain injury or stroke, or maybe agencies like, the Brain Injury Network or the Heart Association. We're always looking for creative ways to partner and to help write grants for nonprofits. We are actually a for-profit agency, but we're always helping individuals try to find access to services. So we're more than willing to help with that. So in summary, we hope that you learned what is music therapy, where is music therapy utilized, what does a music therapist do. We're hoping that you learned a little bit about neurologic music therapy with brain injury and stroke, as well as music therapy reimbursement. With that is all I have for today. Anna, do you have any additions?
No, other than thanks for joining us.
Yes, thank you so much for having us here today, and we will close with that.
Yes, thank you, Anna and Emily. Any questions before we wrap up? All right, well, hearing none, I'm pretty sure that we all could benefit from musical therapy after listening to you. I like what you say about us all being innately musical. That is so true, and I can see how it could have such a huge benefit in many ways. So thank you both, and have a great rest of your afternoon.
You too. Thanks for having us.
Thank you.